Today we will be discussing Alzheimer's disease. First, we are going to look at some background information regarding Alzheimer's disease. So what is Alzheimer's disease? Well, according to the Alzheimer's Foundation of America, Alzheimer's disease may be defined as a progressive, degenerative disorder that attacks the brain's nerve cells or neurons, resulting in loss of memory, thinking and language skills, and behavioral changes. Alzheimer's disease was named after Alois Alzheimer, who was a German doctor. And in 1906, he had a patient named Auguste D. who presented symptoms of what is now called Alzheimer's disease. These symptoms included memory loss, abnormal behavior, and shrinkage in the patient's brain. However, it was not until 1910 when Emil Kraepelin, a psychiatrist, gave a title to these symptoms, calling it Alzheimer's disease after Alois Alzheimer. Now let's look at the common signs and symptoms of Alzheimer's disease. These signs and symptoms include memory loss, challenges in planning, challenges in solving problems, challenges completing daily tasks, confusion such as time, place, and names, difficulty speaking or writing, misplacement of items or objects, and mood or personality changes. It is important to note these signs and symptoms of Alzheimer's disease in case you, a loved one, or friend exhibit these signs and symptoms. You or they may want to seek medical attention or talk with your or their doctor. With regards to the effect of the brain caused by Alzheimer's disease, we have two brains featured in this slide. The brain on the left is a healthy-looking brain, whereas the brain on the right is a brain affected by severe Alzheimer's disease. Later on in this video, we will discuss the three main stages of Alzheimer's disease. Right now, it's important to note that severe Alzheimer's disease is the last stage and most extreme case of Alzheimer's disease. As the red arrow points to, there are severely enlarged ventricles within this severe Alzheimer's disease-affected brain. With large ventricles comes an increase in fluid. Fluid within the brain is never a good sign because it can lead to convulsions and even brain damage. In addition to the severely enlarged ventricles, we also see severe shrinkage of the cerebral cortex and hippocampus areas. These two parts of the brain are involved in thinking, remembering, planning, and memory creating. When these areas shrink, a person is unable to think, remember, plan, or make proper judgments as well as if they had a healthy-looking brain, like the brain here featured on the left. So how does Alzheimer's disease affect the neurons within the brain? This part of the video illustrates two neurons. Healthy neurons are shown on the left, and neurons affected by Alzheimer's disease are on the right. The red arrow points to a cluster of tangles within the neuron. Tangles are twisted strands of protein. There is also a presence of plaques, as directed by the red arrow. With an increase in tangles and plaques, there is a decrease of nerve cells and synapses firing within the brain. Therefore, a patient's brain is affected and they may display difficulty thinking, planning, creating memories, and making proper judgments, as previously stated. In addition, the rate of plaque and tangle progression varies from person to person. However, the average lifespan once diagnosed with Alzheimer's disease is 8 years or so. Next, we will look at some risk factors relating to Alzheimer's disease. First is advancing age. By age 65, 1 in 9 people are diagnosed with Alzheimer's disease. By age 85, 1 in 3 people are diagnosed with Alzheimer's disease. As you can see, as one gets older, the likelihood of developing Alzheimer's disease also increases. In addition to advancing age, family history plays a vital role in developing Alzheimer's disease. If a family member has Alzheimer's disease, you are more likely to develop this disease as well. Some risk factors pertaining to genetics may relate to several genes, including apolipoprotein E and amyloid. With early onset Alzheimer's disease, a genetic mutation is usually the reason for the disease. This is usually due to the gene apolipoprotein E. This gene is known to increase the risk of developing the disease. However, this gene only represents 5% of all people diagnosed with Alzheimer's disease. Furthermore, scientists have discovered a correlation with chromosome 21 and the amyloid gene. In the picture here on the bottom left is a girl with Down syndrome. Many people with Down syndrome develop Alzheimer's disease. This may be due to an extra copy of chromosome 21. Chromosome 21 contains amyloid, a gene that is directly linked to Alzheimer's disease. Scientists are meticulously researching the correlation between chromosome 21 and the amyloid gene. Now let's look at tests and diagnosis for Alzheimer's disease. If you have or are suspected to have Alzheimer's disease, your physician will ask or do the following. They will do a physical test that looks at your diet and nutrition, ask if you are taking any medication, and check your blood pressure, heart, and lungs. They will do a mental status test that checks your memory and thinking skills. They will even do a mood assessment test. They will do a neurological exam that checks your reflexes, coordination, muscle strength, eye movement, and speech. They will look at your brain and see if you have any other diseases or conditions such as a brain tumor, stroke, or head trauma. They will also do a mini cognition test in which physicians will ask the patient to repeat objects said to them a few minutes prior or make a patient draw a clock. These two things are used to test a patient's memory. Furthermore, let's look at the three main stages of Alzheimer's disease. The first stage is known as the early or mild stage of Alzheimer's disease. During this stage, patients may have a hard time remembering words and names. Patients may repeat the same thing over and over again. Patients may forget the placement of objects, and patients may have difficulty planning and organizing. As you can see from the picture on the left, the blue region demonstrates how far along the disease is within the brain. Clearly, the disease has not affected the brain that much yet. The second stage of Alzheimer's disease is called the middle or moderate stage of Alzheimer's disease. During the second stage of Alzheimer's disease, patients display memory loss. They may have difficulty recognizing family and friends. They may have difficulty performing tasks or handling finances. They may need assistance putting on clothes. Patients may become confused easily. Patients may have difficulty expressing oneself, and patients may have difficulty sensing body in relation to objects, so your spatial skills. As you can see from the picture on the right, we have a healthy brain compared side by side to a mild to moderate Alzheimer's disease brain. In the healthy brain, there is normal cerebral glucose metabolism. However, in the mild to moderate Alzheimer's disease affected brain, there is diminished cerebral glucose metabolism, as displayed by the dramatic color differences between the two brains. The final stage of Alzheimer's disease is called the late or severe stage of Alzheimer's disease. The late or severe stage of Alzheimer's disease, as previously stated, is most extreme. During this stage, patients may forget names, mistake people, have delusions, display a need for tactile stimulation, have difficulty recognizing basic survival needs, such as when they're hungry or thirsty, and have difficulty recognizing familiar faces, such as friends and family. The picture on the left portrays a healthy brain next to a brain of a patient with a severe Alzheimer's disease. As you can see, the Alzheimer's disease brain has a large ventricle filled with fluid. Once again, the fluid is not good because it can lead to brain damage. There is also shrinkage of the cerebral cortex and hippocampus areas, ultimately affecting the patient's ability to think, remember, create memories, and plan. So why should we, my group and even scientists, spend so much time researching Alzheimer's disease? Why is Alzheimer's disease so significant? First, let's look at the graph on the left. This graph demonstrates that as one ages, the likelihood of developing Alzheimer's disease increases drastically. With regard to the graph on the right, the projected number in millions of people diagnosed with dementia, a form of Alzheimer's disease, is rapidly increasing. By 2020, it is projected that 6.8 million people will be diagnosed with dementia, and by 2050, the projected number of people diagnosed with dementia will nearly double to 14.3 million people. This indicates that Alzheimer's disease is not only increasing in age, but is also affecting more and more people in the United States of America alone. Some more facts pertaining to Alzheimer's disease include Alzheimer's disease is the most common cause of dementia. 1 in 8 people in the United States has Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death among the elderly. Every 68 seconds, someone is diagnosed with Alzheimer's disease, further justifying the prevalence of Alzheimer's disease in the world today. In addition, Alzheimer's disease is the top cause for disabilities later on in life. 38% of people aged 85 or older in America are diagnosed with Alzheimer's disease. 44% of people aged 75 to 84 in America are diagnosed with Alzheimer's disease. 15% of people aged 65 to 74 in America are diagnosed with Alzheimer's disease. And 2 in 3 people diagnosed with Alzheimer's disease are women. Scientists are unsure why more women are affected by Alzheimer's disease than men, but they are looking into possible genetic reasons. Finally, the most significant fact about Alzheimer's disease is the fact that there is no cure for the disease, as well as no apparent cause for the disease. This makes Alzheimer's disease so mysterious. However, scientists are working hard to discover a particular cause and cure for the disease. There are medications that are used to prevent the onset of symptoms of Alzheimer's until later on in life. These medications include cholinesterase inhibitors, Razidine, Exelon, Aricept, and Namenda. It's important to note that Razidine, Exelon, and Aricept are used to help control the behavioral symptoms associated with Alzheimer's disease. There has also been some stem cell research regarding Alzheimer's disease. The Stem Cell of America have discovered a breakthrough medical procedure where stem cells are administered intravenously and subcutaneously in Alzheimer's patients. The fetal stem cells, which are baby stem cells, travel throughout the body detecting damaged cells and tissues and attempts to restore them. These stem cells can stimulate existing normal cells and tissues to operate at a higher level of function, boosting the body's repair mechanism. There's even been seen some changes shown ranging from 3 to 6 months. This stem cell research is currently in clinical trials to determine the efficacy of treatment. Moreover, let's look at some controversial issues regarding Alzheimer's disease. So some potential controversial causes is the intake of aluminum. Aluminum is found in the Earth's crust and in household products and foods. Some studies have shown that an increase of aluminum has led directly to Alzheimer's disease, whereas other studies have shown otherwise. Even with zinc, some studies say that too little zinc may lead to Alzheimer's disease, or too much zinc may lead to Alzheimer's disease, whereas other studies, once again, have shown otherwise. Even some foodborne poisons, which means toxins in food, may lead directly to Alzheimer's disease. And possible viruses and infections may also lead to Alzheimer's disease, whereas other studies say that it's not true. With regards to some controversial issues regarding family and end life, here are some questions that families have to face at the end of life. Should a person with Alzheimer's disease be placed in a long-term care facility? And is it okay to stop visiting a person with Alzheimer's disease when he or she does not remember or recognize you? These are just some questions that families of loved ones with Alzheimer's disease face when trying to figure out what is best for their loved ones as well as themselves. Now let's look at some ethical questions. When should psychiatrists issue more formal testing? Or, if a patient reports memory problems, should the psychiatrist inform the patient about the potential risk that it may be or lead to Alzheimer's disease? Some medical professionals say yes, because it may encourage patients to get screened and tested, whereas other medical professionals say no, because patients may become depressed. I definitely think that if a patient reports memory problems, the medical professional should inform the patient about the potential risk that it may be or lead to Alzheimer's disease, because patients have a right to know all possible outcomes. This allows them to prepare for the future and understand potential risks and possible treatments associated with Alzheimer's disease. Another question is, should patients have access to the genetic information? Some medical professionals say that since there is no cure, the genetic information may not be helpful, whereas other medical professionals say that there is an APOE genotype that is common in patients with dementia, so this may be helpful for people to know. I definitely think that patients should have access to their genetic information and full disclosure of the genetic information if they ask. The last question is, should psychiatrists ask patients regarding what they may want done to them or who will make the final decisions for them during the early stages of Alzheimer's disease? Some psychiatrists or medical professionals say that yes, because during the middle and late stages of Alzheimer's disease, patients may not be able to express their wants, needs, or desires, whereas other psychiatrists may be more reluctant because they do not want their patients to fear their future and future outcomes. Their patients may, as a result, become depressed. I definitely think that psychiatrists should ask patients regarding what they may want done to them or who will make the final decisions for them during the early stages of Alzheimer's, because during the middle and late stages of Alzheimer's disease, patients exhibit improper judgments and display mood or personality changes. They may not know what they want or need because of the shrinkage of the cerebral cortex and hippocampus areas. By discussing what the patient may want done to them later on in their life, medical professionals are respecting the patient and allowing him or her to properly prepare for his or her future. I also think that this discussion should be held with a patient, doctor, and family members so that everyone is aware of what the patient respectively wants or desires for his or her future. Now we have a biomarker controversy, and biomarkers are used to diagnose diseases. According to thelancet.com, drug developers use biomarkers in clinical trials to reverse the buildup of neurotoxic culprits of Alzheimer's disease. Like any other controversy, there are some that are opposed to biomarkers and those who are in favor of biomarkers. So, those opposed to biomarkers state, assessment of biomarkers is an academic exercise since the measurement will not affect clinically relevant outcomes such as change in treatment, disability, and quality of life. They argue that biomarkers are often abnormal and cognitively normal individuals and have no meaning. Basically, what they're saying is that biomarkers are not accurate and they don't lead to any cure or treatment of Alzheimer's disease. Whereas those in favor of biomarkers state, clinical diagnoses are often wrong. A diagnosis per se is a medical action in that knowing that the disease is present has a value in itself, even when effective drugs are not available. Biomarkers can be early markers for the disease, which can precede cognitive impairment by several decades. Basically, what those in favor of biomarkers are saying, that even though they may not have a cure or a treatment to it, it does show some signs and symptoms of Alzheimer's disease, and it can help scientists learn more from the brain. Therefore, it's good to do. And I definitely agree with this. I think that by using biomarkers, the field of science is able to extend on, and that maybe later on in the future, there will be a cure and a treatment for Alzheimer's disease. So thank you so much for watching, and I hope that you enjoyed the video.